We're going to go ahead and get started with our climate and health panel. So I'm going to pass the mic over to our moderator, Sarah Sharp.
Good morning, everybody. Thank you again for everybody who's here and for the invitation to moderate this panel. It's a very esteemed panel and I think we're going to have some really interesting conversations. My name is Sarah Sharp. I'm the Deputy Executive Director at Central California Asthma Collaborative, and I'll talk a little bit more in a second about what we do at our organization. I've noticed that the organizers of the conference are not afraid to tackle the most difficult issues we have in our region, so I appreciate that. This topic as well, but water is definitely water, land, all of our topics that we've been challenged with finding solutions for over the last few generations. I wanted to just mention that I have noticed a little bit of missing sector from this conference, which is actually a group of people I was supposed to be meeting with today, and I decided to come here first, and I'll go over there later. But there is a pretty robust environmental justice movement in our region, and they are all convening today at another place a few miles from here to come up with their people's vision for energy. And so I think that's a really important topic that is in line with a lot of what you all are talking about. And as an environmental justice movement, I'm a longtime member and part of that. We have been constantly finding ourselves fighting things and saying no to things that we are concerned about. And I think that we all decided that we wanted to figure out what our vision is of what we do want. What do we want for our energy system here? And that includes transportation, sustainable ag, not so much water, but water, as you heard previously, is very intertwined with our energy system. But I just wanted to mention that that's happening, and maybe that's why none of them are here today. And also, I was watching yesterday online because I am a little bit under the weather, and I really appreciated Masimoto's talk yesterday to kick this off. He really brought it home, down to the ground, deep in the dirt and the roots of where we are, which is very important to us and myself personally. But what especially struck me was the sound that he mentioned of climate. And I don't know if everybody was watching yesterday, but he kind of asked everybody to imagine what sound you associate with climate. And his was the sound of a swamp cooler. And to me, I was actually really surprised that that's what he said, but it's actually very relevant to the work that we do at my organization, and a lot of us in the environmental justice are doing right now, because we are kind of focusing and looking in at the opportunities that building decarbonization for the sake of climate as a climate measure can really and truly improve the lives of the most impacted families in our region. And so swamp coolers, even though he kind of evoked them as like a memory of the past, are very, very common still today in our, especially in low income and older housing. And so they really provide an opportunity if we can figure out how to transition a lot of those swamp coolers into HVAC, traditional HVACs, or even better, heat pump HVACs that are electric. We could, with our poor air quality and increasingly frequent wildfires, there's an opportunity to create safer spaces to breathe. And, or in more technical terms, improved indoor air quality for vulnerable populations, like our asthma patients that I work with at my organization. So I just want to say thank you to the organizers of this conference, and I think there's been a lot of very important conversations, but there are some people missing if we really want to come up with collaborative regional solutions. And I would invite all of you to engage more with the other organizations. I'm happy to mention many of them who are working every day in the ground, organizing and advocating with our grassroots residents, primarily low income and disadvantaged communities. I will go to the next slide. I think this is just an overview of what CCAC does. So we were founded in 2011. We have about 6 offices across the valley we just opened an office in Sacramento. So we go from Sacramento down to Bakersfield. We have about 55 employees, I think maybe 57 as of this week. And nearly half of them are community health workers. We work in these 3 program areas, which I think are very relevant to our conversation today. All 3 of them, actually. We work really at the crossroads of climate and health. That is kind of how we see ourselves. And so our programs are climate equity and environmental justice, which includes a lot of specific program outreach, like electric vehicle incentive program outreach in disadvantaged communities. But it also includes advocacy at the Capitol and sometimes at the federal level on air quality and environmental climate issues. We also, as I mentioned, the energy work that we do are looking at building decarbonization along with transportation electrification and energy in general. We work a little bit on carbon capture and sequestration as a concern for community health. And then we have an SJV Air app, which hopefully you all are familiar with and you can check it out. It is a way to check your PM 2.5 with a lot more monitors. We actually have the US EPA, the CARB, all the Valley Air District, all of the official monitors are included in there, but also Purple Air. And then we have our own network of, I believe, 400 other monitors that we put out that are usually Purple Airs or FAMs. And so that's a great tool that we have been working on to build a community-led air monitoring network, which I think in today's times, we see the importance of creating our own community systems like this because we can't always count on the government. And then community health, as I mentioned, we have a whole team of people working on doing home visits for families dealing with asthma, and we do asthma remediation. That's a Medi-Cal provided service. And we contract with most of the Medi-Cal providers across I think we serve 13 counties now. And then research, and that's very important. We collect a lot of data and we want to be a data-driven organization. So we're partner with all kinds of academic institutions, UC Berkeley, Lawrence Berkeley National Lab. I forgot to check, but I think we still have projects with Stanford. We do quite a few projects and we collect data usually. And so, for example, we're collecting data now on indoor air quality when you transition from your appliances from natural gas to electric to see what the improvements are or what the differences are in indoor air quality. So we do that kind of projects. So without much further ado, I want to introduce our panel. We have really important people who are going to share really different perspectives and hopefully some solutions and ideas. I've worked for, I don't know how many years I've known Dr. Sherriffs now.
Since 2011, coincidentally.
No, might be longer, no?
Probably longer.
Yeah, no, I think it was longer. I've been working in the field of air quality and climate almost since I first got out of college in 2000. So anyways, Dr. Sherriffs holds a BA degree from Yale University, which I did not know, and earned his medical degree from UC Davis, followed by completion of the Family Medicine Residency Program at UCSF Fresno, which is probably how we got to keep him. Dr. Sherriffs is the past president and former chair of the Public Health Committee of the Fresno-Madera Medical Society. He was a fellow of the American Academy of Family Physicians. Dr. Sherriffs also served as the co-director at the UCSF Fresno Alzheimer's and Memory Center. And he was appointed by Governor Brown in 2011, but I think we knew you before when you were at the Medical Society, to serve on the San Joaquin Valley Air Pollution Control District Board and the California Air Resources Board, serving on the latter until 2024. And he has served, it looks like 4 terms on the Valley Air District, 4 or 5. Yes, so we really appreciate his perspective, and his position actually was the result of some advocacy that a lot of us did from that movement I was talking about to get a doctor and a scientist added to our Valley Air District board. And so we are very thrilled to have him, and I can't wait to hear what he's going to share. Dr. Sherriffs.
Can you hear me okay? So these are some of the hats that I wear. And doctors always begin talks with disclaimers. I am not a spokesperson for any of the first 3 up there. Although I want to express my gratitude to the Air District for helping prepare some of the slides. And I'm not a spokesperson for my kids anymore. And the grandkids, I don't know. You know, everybody from the Valley has said thank you to the organizers, which says something about how important this is, how important this topic is, how important it is, how grateful we are to be having discussion and looking forward to future discussions. The Valley really is ground zero for these problems, and also ground zero for solutions. So I'm going to talk about 4 things, hopefully 5 minutes or less on each. Our air quality challenges, progress that we've made in terms of air quality, threats to further progress and maintaining the health gains that we have achieved to this time, and opportunities for moving forward, particularly thinking about climate. So the Valley Air District that I've been a member of since 2011, agency responsible for air quality in 8 counties, a 15-member governing board, 13 are elected officials from city governments, from board of supervisors, and 2 are governor appointees. The charge, the authority, is to regulate stationary sources. There's not an authority to directly regulate mobile sources. And also climate is not an explicit authority nor a mandate for the Air District. But the mission, the good news, the Air District is a public health agency. So why do we have the challenges we have? It's the geography that we love and a little bit about the meteorology that we love. But we've got the mountains, we've got the Coast Range that hopefully will explode in beautiful wildflowers in a few weeks. But it's this basin. Geography, meteorology, everybody understands the foggy winters, the hazy summers, it's the inversions. And so to paraphrase Las Vegas, the pollution we make here stays here. The corollary to that is that the chemistry of the heat in the valley adds to the unhealthful qualities of the pollution we have. So major challenges. So where's the pollution come from? Comes from us, primarily from transportation. It comes from combustion of fossil fuels. So it's transportation of us, how we got here, hopefully in our electric cars, but however we got here, and of goods. And we understand goods movement. Well, it's key to the economy. It's how do we get these marvelous agricultural products to the rest of the nation and the world. So huge benefits in terms of the transportation, but also huge costs. Plus, has been mentioned, our population in the valley has particular vulnerabilities. The Cal Enviro screen, if you're not familiar with it, by all means, Google it. It's a wonderful tool, but it looks at social determinants of health. So determinants that are strongly related to health outcomes, education, income, language barriers, access to health care, pre-existing health conditions like asthma, blood pressure, diabetes, and the most at risk are concentrated in our valley, disproportionate to the rest of the state. Other parts of the state certainly have, I won't say their fair share, but have lots of these difficulties too, but we disproportionately have this. And this is a population that is exposed to these excessive levels of air pollution. So what are the pollutants that we worry about? The main 2 are ozone and PM. Ozone is that summertime smog. Ozone is that stuff that when I was a kid growing up, I hated going to LA, absolutely hated it. My eyes watered, my throat was scratchy, my chest was tight. I could not understand why anybody would live in that. Where does it come from? A lot of sources in terms of industry, but primarily, again, 85% of the source, it's transportation, mobile sources. So why is it important from a public health standpoint? As well as those irritations that I experienced as a kid. It's a huge driver for respiratory disease. It's a huge driver for asthma. It's definitely one of the important reasons that we have highest asthma rates in children of anywhere in the nation. So clearly more utilization of healthcare services. And one reason some of us get particularly nervous when things like Madera Hospital closes. Particulate matter, the other big concern big challenge. So, if you can see it, it's probably not good for your health. The smoke coming out of a stack on a truck or a tailpipe. Particulate matter comes in two flavors in the valley. There's the directly emitted PM 2.5 and PM10, but directly emitted, so that's the combustion, diesel, fireplaces. Then the indirect, which back to NOx, nitrous oxides, main former for ozone, again, combustion product. Because of the chemistry of the valley, because of the heat of the valley, you can take that gas and form particulate matter, and you can form these small particles. So we live in a laboratory beaker. Health effects of PM 2.5. PM 2.5 is the killer. Particulates are the killer. You'll hear about PM10, PM 2.5, ultrafines. Where do those numbers come from? They're not arbitrary. PM10, that's the stuff our upper airway stops. Your nose stops, the upper airway stops. The smaller stuff, the 2.5, the ultrafines, those get deep into the lung, and they can get so deep into the lung that they then pass into the bloodstream. They tend to be highly inflammatory, which is a word that should make everybody cringe. And that's why we have the associations with cardiovascular disease. It's why if you could choose when to have a heart attack, do not have a heart attack on a bad air day. The outcomes are much, much worse. And also because of that crossing into the bloodstream, research, it's a risk factor for dementia, as well as a number of other health problems. So where's it coming from? As we talked, combustion, transportation, so heavy duty diesel, 25%. Other on-road mobile, that's you and me if we're not driving our electric car, 9%. Off-road mobile, construction, when we're having fun in our boats and our ATVs, 17%. Farm equipment, close to 20%. Trains, 9%. Significant sources, challenges to deal with. So that's for PM 2.5 and the NOx. Again, directly emitted PM 2.5. The main reason I wanted to share this slide. So again, similar kinds of things, farming operations, fireplaces and wood stoves. That's been a huge success in the valley. Heavy duty diesel, it's only 2%, but that is where cancer is in air pollution. And it's worth remembering, boy, if it's only 2% now, that is the #1 cancer risk from air pollution. And so, it's only 2%, but it's important stuff. It's dangerous stuff. But a big success how far we've gotten. And why have we gotten that success? Emission controls, state and federal regulations. The California waiver has been hugely important in the past under the Clean Air Act. California can ask for emission standards tighter than EPA. That's an open public process, negotiations with the manufacturers. It's not an arbitrary thing. In the past, waivers have been granted for California. It's been a huge part of why we've had the success we've had. We absolutely have been making incredible progress. Major NOx reductions, looking at 1980 to 2023. And just a reminder, if you lived your entire life in the valley with 1970s air pollution, you shortened your life by about 2 years from the health effects. So that's quite an accomplishment, but it's also a reminder that this stuff, very important, very health impactful. So mobile sources, big changes, stationary sources, small contribution, but still important. Ozone, because of NOx forming ozone. You can see from this improvements from 2000 to 2023. Orange is bad, green is good, but a reminder, the 2015 standard is at 70, which is that green. And this is good, but it's not helpful. It's certainly a huge improvement, but we have a long way to go. Better, but not helpful. So how's this been accomplished? And the PM 2.5 reductions, again, following along. Great progress, still a long way to go. New standard 2024, more healthful standard. We have a lot of work to do to get there. Another way of looking at the progress, 40% of days exceeding the standard back in 2002, now close to 5%. So good, but troubling. So how has this happened? Regulation, changes in emission standards, regulations of local industry, and a lot of voluntary incentive programs, a lot of money. $3 billion in local, state, and federal funding to help the transition. Some of the kinds of projects that have been funded over the last 15 years, tractor replacement, the older tier 3 tractors up to tier 4, or even electric tractors, heavy duty truck replacement, agricultural irrigation pumps, electrifying the diesel pumps out in the fields, alternatives to egg burning phase out. This year, no more open agricultural burning, locomotive replacement programs, fire change outs, public involvement here. Drive cleaner program, helping people get their cars meet smog, lower their emissions, and even trade their older cars for new cars, for EVs. Charge up program, school bus replacement, great program. Electrifying school buses, clean air rooms, we talked a little bit about. Lawn and garden equipment. Boy, it is such a joy to have a battery-powered whatever in the yard instead of having to gas and oil and busting your knuckles and all that stuff. Not to mention, you know, you smell it and you feel like you're doing some work and, oh, you smelled it. It's not good for you. Funding source is very important. You know, we've talked a lot about collaboration yesterday and today. Collaboration, absolutely key. It's the only way we get anywhere. Federal collaboration, state collaboration, local collaboration in terms of finding money. The majority of money, however, the majority of money has come from the state, and it's come from cap and trade funding. Hundreds of millions of dollars over the last couple of years to help businesses make the transition to cleaner technologies, to drive cleaner technologies, to help individuals do the right thing in terms of getting electric vehicle rebates, in terms of changing their lawn and garden equipment, in terms of changing out their fireplaces. Climate change. What does climate change mean for air quality? It's nothing but trouble. It's nothing but trouble. We think about the progress that we've made. It's going to get hotter. Is it going to get 2 degrees hotter, 4 degrees hotter, 5 degrees hotter by 2100? Whatever it is, that's going to facilitate ozone formation. It's going to facilitate secondary PM 2.5. One of the factoids that I came across in the last couple of weeks. So if we look at the gains that we've made nationally with PM 2.5 over the last 10 years, the health gains, 75% of the US has lost 25% of those gains because of the health impacts of wildfire smoke. So 75% of the nation in the last 10 years has lost 25% of the health benefits from all that hard work, lowering PM 2.5, all that money eroded. So wildfires, huge issue. We know climate change is driving bigger fires, hotter fires, has extended the wildfire season. So wildfire exposure, yeah, irritation, respiratory symptoms, reduced lung function, cardiovascular effects, heart failure, heart attack, increase emergency room use, hospital admissions, stroke, premature death. The other problem with wildfire smoke, when it gets into urban areas or on the margin where there are homes, it's not just wood smoke. It's now burned plastics. It's now old asbestos. It's now burned electronics. And I can't imagine anybody in this room wants to breathe that stuff. But that's what we're now facing increasingly with this. Greatest risk, these are the sensitive groups for air pollution, for wildfire smoke. You know, I don't want to reveal anybody's private health information, but I'm sure if we had people raise their hands, okay, who's got asthma or respiratory disease? Who's got cardiovascular disease, including high blood pressure? Who's less than 18 here? Anybody pregnant? Any older adults? Anybody over 65? Any low socioeconomic status? Anybody work outside? I am sure we would have over half the hands. I'm sure we would have over half the hands. And one thing we haven't talked about, and I hope we will have more conferences. If you're looking for a topic for a conference, I have a topic for you. It's heat. It's heat. And there's so much to say about heat. You know, again, heat is the #1 killer in environmental disasters. It's not hurricanes, it's not wildfires, it's not tornadoes, earthquakes. When you look at the world, heat is the #1 killer. And we who live in the Central Valley, I think we all think we understand heat, right? And we're just, oh, we want to set another record, you know, let's go three weeks consecutive days over 100. We think we understand heat. It blinds us to what 2 to 4 degrees average increase in temperature is going to do. We do not understand heat. So how can we protect ourselves? Be aware of the air quality. I want everybody to keep exercising, but you probably shouldn't exercise outside when air quality is impaired. Home filters work. Be sure you got a MERV 14 or better. All HEPA filters are that or better. Home combustion. Stoves, gas water heaters, lawn and garden. If it's combustion, it's not good. So think about electrifying those things. Some air quality tools to help you. The district, I like this because it's tied to sensitive groups and also activity. He's given me 1 more minute. Thank you. So change your world, less combustion, drive less, avoid idling, carpool, bike, walk. Be sure the next vehicle you buy gets better mileage, lower emissions, and if possible, go electric. Heat pumps, solar and electric water heaters, electrifying equipment, changing out fireplaces, and of course, energy conservation. Change the world. If you're successful, you love your electric car, share the experience. If it didn't work for you, share that experience. You don't want people to do something and then be disappointed. If you've got unavoidable emissions in your life, think about carbon offset programs. Support agencies, organizations that are involved in climate, involved in air quality, like CCAC. Bring climate, air quality, and the health mindset to every organization you belong to. We are always making choices, and choices have consequences. Our daily choices matter. So you are making a difference. Thank you.
Thank you, Dr. Sherriffs. That was great. Set the tone. As you can see, we have a wide range of health and climate issues. 2 things that I just wanted to raise up before we go to the next speaker that came to mind from that talk. First of all, something that I think you probably gleaned from his presentation, but what is important for us here in the San Joaquin Valley, a lot of people anyway, residents, is that any climate measures that we must have co-benefits. So for us, localized air pollution reductions in tandem with greenhouse gas reductions should always be a priority. So that's why we find it hard to support things. I mean, obviously we are concerned about climate and want to be leaders in reducing greenhouse gases, but that can happen anywhere on the earth. And so when things are happening here, we want them to also have air pollution benefits for the health reasons that Dr. Sherriff mentioned. And secondly, I also wanted to, when he mentioned heat, it brought to mind that there is a movement right now, a policy movement advocacy to set a health standard for maximum temperature that can be allowed in housing in line with what we already have in most. I think most states have a minimum standard. So if you rent a house, you are required to have heating for your renters, but there isn't the same requirement currently to have cooling. And so there is a movement of people working on that. It's very interesting. So we're going to go on to the next speaker, and we'll have questions at the end. So don't worry, we'll open it up. Hopefully we'll have time. But the next speaker is Dr. Trinidad Solis, who MD, MPH. She is the Deputy Health Officer for the Fresno County Department of Public Health. Her duties include guiding Fresno County's health response to disease outbreak and assisting with health programs that promote chronic disease prevention. She also helps coordinate the department's Rural Mobile Health Program, which makes healthcare access more equitable for farm workers and for people living in the region's rural areas. She received the Physician of the Year Award by the National Hispanic Medical Association in 2023. And Dr. Solis completed her undergrad degree at Stanford University. She then earned her medical degree at the UC San Francisco and later trained as a resident in family medicine at UCLA Medical Center. She also obtained her Master of Public Health degree from Johns Hopkins. She really likes education, I can tell. And we are glad that she is here in Fresno now. And her topic is actually very interesting, something I'm looking forward to learning more about because of our drought, or often drought, and the conditions that come with having more dry and sigma and retiring our fields and having more dry lands and having more dust. And so she's going to be talking about valley fever. Without much further ado, Dr. Solis.
Hi, good morning, everyone. As was mentioned, I decided to focus on a disease that is climate sensitive, where it is affected by the cycles of rain and drought. And a lot of the lessons that I'm going to discuss, we at the health department here in Fresno County, we also apply some of our messaging to vulnerable communities to other types of illnesses that are impacted by the weather, such as heat, as was mentioned earlier, asthma, and even during bad air quality days, just how we message to vulnerable communities. So that's the theme that not only applies for this disease, but other diseases related to the climate. So I want to start off by talking about what is valley fever, so we're all on the same page here. So valley fever, it's also called coccidioidomycosis, or cocci for short, and it's a disease caused by a fungus that grows in the soil and in the dirt, and it's very prevalent here in California and just really southwestern United States. Most often, higher cases are in Arizona and like as I mentioned in California, but in California, majority of the cases come from the Central Valley and the Central Coast regions. And so people can get valley fever by breathing in dust from outdoor air that contains valley fever fungus. And anyone who lives, works, or travels in an area where valley fever has been reported can become infected, including pets. And here's just a picture of the valley fever fungus under a microscope. And so for valley fever symptoms, it usually affects the lungs and can cause prolonged respiratory symptoms. So I have a graphic here that shows you some of the symptoms that can appear in valley fever. But I want to preface this by saying that a lot of people can get infected and may not ever develop symptoms. And those that do develop symptoms, usually it happens 1 to 3 weeks after the exposure occurs. And for those that develop symptoms, it can be fatigue, cough, difficulty breathing, fever. And then if it does go beyond the lungs, it can cause other symptoms such as muscle or joint pain, night sweats, chest pain, weight loss, and so forth. So it is rare when the valley fever goes outside the lungs. It happens in about 1% of cases. And I do want to mention that valley fever is not contagious, so you can't spread it from one person to another. So with valley fever, a lot of the symptoms sound similar to other respiratory illnesses like the flu, like COVID. So we definitely here at the health department send health advisories to our physicians, not only here locally, but even on the state level. The state health department reminds physicians to keep valley fever in the differential. So if a patient isn't getting better on antibiotics, do testing for valley fever, and it's a blood test, and that's how you can check for the fungus. And also, we can do some lung imaging like X-ray or CT to check for to see if it's spread beyond the lungs and so forth. So again, with valley fever, it is, even though it's very prevalent, it is a disease that we're not only educating the public about, but also our providers to keep it on the differential when they're seeing a patient that has prolonged cough for like over a week or so. Dr. Sheriff mentioned about the groups at risk. So similar for valley fever and other diseases, these are the sensitive groups that people who are over the age of 60, pregnant women, diabetes. Interesting, it does say that the research shows that people who are Black or Filipino do have more rates of severe disease. So there's more research to figure out why. Is there a genetic link, or why is that the case? And also people with health conditions that weaken the immune system, such as having cancer or others like HIV, other diseases that suppress the immune system. And so valley fever is on the rise in California. Most cases, as I mentioned, are from the Central Valley and Central Coast regions, but we are starting to see it a lot more in Southern California, and that wasn't really the case in compared to prior years. And so there's possible, reasons for why we're seeing this increase. And a lot of research is going into looking at the climate impacts on valley fever, but research is showing that when it rains a lot, that helps the the fungus grow. And then during really dry periods and when it's dusty and windy, that helps propel the fungus into the air. And so when we have these cycles of rain and, long periods of drought, more researchers are starting to see patterns of increased growth of this fungus in the soil. So that is something that is continually being studied. And similar to what Dr. Sherriffs was saying about the wildfires being propelled with the drought, similar with valley fever and this fungus, even with wildfires, we see the spores being blown out in the air. So there has been research showing that. So just showing some parallels with not only valley fever, but with wildfires and so forth. But we do want to remove confounding variables, and so research is looking into, well, is it because there's an increase in soil disturbance activities in high risk area, meaning more construction now, and areas where it may be dusty, and then increased disease recognition, testing and reporting, meaning, as I mentioned, we're trying to educate more physicians to keep this on the differential and check for valley fever. So that may also lead to increased cases. But overall, really just we're seeing, and I'll show you all some data in the next few slides about how locally we're starting to see an increase in cases in the last few years. But before I do that, I want to give you all a recent example of how concerning valley fever can be in the area. So this happened where valley fever cases, we saw a spike after a California outdoor musical festival took place, and this happened in Kern County of May of last year. This made national attention, but about 20,000 people came from all over California and different states to attend an outdoor music festival. And then, as I mentioned, usually about 1 to 3 weeks later after exposure, people can get symptoms of valley fever. So several people started to develop valley fever symptoms, the cough, fevers. And so the California Department of Public Health got word of this, and they sent a survey to all the people who attended. And that's where they noted close to 20 people were confirmed to have valley fever from the blood work, and close to I think 10 were hospitalized. So again, just showing it's not really just those people who work outdoor now. These are just attendees who went to an outdoor concert. And so this really brought a lot of attention about how about having like future events in the future outdoors? What does this mean? What precautions can we tell the public? So this was the first time in a while where something on this larger scale happened due to an outdoor event. I think for us, it's just really an event where we wanted, for us at the health department, wanted to educate. It was an opportunity to educate more people in the public about this disease and how to prevent it. So I want to share some data about valley fever in Fresno County. And for those who may not be from the area, Fresno County is the largest county in Central California. And as I mentioned, most of the cases of valley fever occur in here in the Central Valley region. So apologies, the font is a little small there, but I'll highlight what I think is the most important points. So this is a picture of Fresno County and the cases of valley fever in Fresno County by zip code for 2024. And as you can see here, the darker the red color, that means more cases. And a lot of our cases are in the rural areas and the western part of our county. So this is a lot where there's a lot more fields, a lot of where agricultural workers may work and live. And so really affecting a lot of our vulnerable communities here in our region. And this is a graph of valley fever cases by year in Fresno County. And for those who can't see below, it starts from 2010 to 2024. We're still finalizing some of our data from 2024. So sometimes there is a lag for the last few months of 2024. So just keep that in mind that it is still being finalized, but I wanted to show it just to show you the general trend that we are seeing a general significant increase for last year in valley fever cases. And this isn't just here in Fresno County, as I mentioned, statewide as well. And the health department, California Department of Public Health last August put out a health alert. Really, it was a news release telling the community, hey, expect more cases. This was last fall because of the recent rains and droughts that they were expecting to see more. So that is something, again, that we saw in our area. And again, apologies, there's a lot of colors here, but really it's showing from the years from 2013 to 2024, and our team marked it in different colors, but it goes from January through December, and it's showing valley fever cases by month for the past 10 years in Fresno County. And really the takeaway message from this is that most of the cases get diagnosed in the late summer, early fall months. So really like August through October. And so here in California, we designate August as Valley Fever Month. And that's a time where a lot of our health departments in the Central Valley region and those again, Central Coast, we do a lot of messaging to the public about who may be at risk and how to protect yourself. And here's a graph showing valley fever cases by year and race and ethnicity in Fresno County. So this data is incomplete because we only get some of this data occasionally from labs and confidential morbidity reports, which means, so this is a reportable disease. It requires all physicians or labs, if someone tests positive, they have to submit the result to the health department. This is how we can count how many cases there are. But so sometimes we get the information about demographics, but I still think it shows a general trend about who's being infected. And so it goes from 2011 to 2024 here, and the color purple, it says Hispanic. So as the Hispanic community is shown to be, as you can see, making up a lot of these cases, valley fever. And then the pink color, it says white, and then green says Asian. So just so you can get a general idea of who's mainly being infected. And then lastly, here is a slide that says valley fever cases by year and age range in Fresno County goes from 2015 to 2024, and it's different colors. But really what I want to highlight is that the colors where it's the highest is the age range 25 to 34, 35 to 44, and 45 to 54. So really, middle age, I would say, group, and a lot of it, as I mentioned before, outdoor workers. So this may be, we need to look more into this, but could be because a lot of the outdoor workers are more exposed, and this may be the age range of the working population. So how do we prevent valley fever? So in general, at the health department, we try to do a lot of messaging and targeted messaging for those who may be working outside, but we let the community know that in general, when it's really windy, try to stay indoors and close the windows indoors during times of increased dusty winds, and consider wearing a properly fitted N95 mask when doing exposure, when you're outside and doing any activities that involve digging the yard work, gardening, and so forth. And for outdoor workers, we again promote this wearing the N95 mask when you're in a dusty area. And we realize, for a lot of our farm workers, the messaging is more about protecting yourself, not avoiding work, but it's like when you're out there, how do you do it? So cloths and surgical masks not really effective against valley fever, similar to wildfires and so forth. So we do promote the importance of using N95s on those days where it's really dusty, or for our construction workers, if they're going to be disturbing the soil, to wear that mask. And in general, for the public, we tell them wet the dirt before digging to prevent stirring up dust into the air. I wanted to talk about a program that I helped develop and now coordinate, and it's called the Fresno County Rural Mobile Health Program. And I want to highlight it because this is one way we reach vulnerable communities, and not only delivering access, increasing access to care, but we also, this is how we educate about different diseases, including valley fever. But this program started in 2023, and we contract medical providers in the community to deliver medical services, checking, for example, diabetes, blood pressure checks. We offer vaccines and so forth. And then we also have a network of community health workers that speak different languages. And so they assist patients with their social needs. So if someone doesn't have a primary care doctor, they can get connected. If they don't have health insurance, they can also get signed up for that in one visit. And so this program, we recently won the state award for this last year for 2024 and got recognized recently because a lot of other health departments are doing mobile services, but connecting it with a community health worker model where they're going out and educating the community. That is something different that we're trying to do here. And so this is just a slide where at one of our events where there's community health workers talking to some agricultural workers about different education as discussed, including valley fever. And so I want to talk about a campaign that our health department developed in 2023. And we worked with a local marketing agency, and we discussed the importance about adjusting the health literacy to the community. We developed these toolkits that we sent to our agricultural employers that included not only a poster that talked about valley fever, how to prevent it, wearing the mask, but we actually included the N95 masks in the packets, and also just some other merchandise like cooler stickers and so forth, just to bring awareness about this disease. And right now, we're talking with the state health department because they really found that some of these tools were very effective in reaching our vulnerable communities. And so we're trying to discuss how they can replicate some of these aspects of this campaign on a statewide level. And so I just want to share that this is one example of a disease that's affected by changes in the weather and the climate, and what can we do? What are we doing about it? And so I wanted to share with you all that what we're doing to prepare communities, especially vulnerable communities, and the lessons we learned about adjusting to the health literacy and developing these campaigns where we actually go to the agricultural employers and develop these educational information. So that's very key about preparing, and also, as I mentioned, public education. In addition, about educating our physicians about keeping this in the differential. We send out health advisories. We're also discussing how we can better work with our primary care and urgent care doctors so that they don't miss this. And as I mentioned before, and as Dr. Sherriffs also mentioned, the importance of collaboration, where we couldn't do this work alone at the health department. We rely on our partners of our medical teams that we contract out, but also our community-based partners that speak different languages. We have teams that not only speak Spanish, but also organizations that speak indigenous languages to reach our agricultural workers. And all our ideas are welcome. We always tell our community and community-based partners, if you have ideas how we can be more effective in reaching our communities, please let us know. We're open to hearing that. And I want to end by showing, so this is a slide that was taken from an article published in the New England Journal of Medicine. And it's just showing how climate can affect different parts of different types of diseases. And so Dr. Sherriffs talked about the air quality and, it can exacerbate asthma and cardiovascular disease, which is #1 cause of death here in Fresno County and also on the national level, but also with heat illness, how that's all related. But, as mentioned about valley fever, so valley fever is not, it's fungus, as I mentioned, but it's not related to mosquitoes and so forth. But there is a whole section where we're starting to see changes in diseases that are caused by mosquitoes, but now we're seeing it in different parts of the world. So, for example, let's see here. So there was a dengue, for example, which is a type of disease spread by mosquito. No, normally we see that in tropical areas. And in LA County last year, they put out a health alert saying they're seeing local cases of dengue there, meaning the patient didn't have history of recent travel. So very concerning, and that now they're starting to see that. So just want to show that valley fever is one example of how the changes in weather is affecting the disease distribution. And it's not just that disease. As you can see here, there's a lot of other ones, both infectious diseases, but also chronic diseases, as we talked about with the heart disease and so forth. But, you know, I think what we talked about, what can be done, working together is definitely key. And I'm happy to answer more questions afterwards. So thank you.
Thank you, Dr. Solis. I learned a lot. And in fact, I remember now, many years ago, one of the project managers, not to scare any of you who are here from Stanford, but one of the project managers of one of our research projects, actually studying San Joaquin Valley air, because she spent so much time down here, ended up contracting valley fever. And she definitely wasn't working in the fields. But let's move on. We have time. We have time. Our final speaker is, I'm really excited to hear about, is going to bring it really down to the grassroots community level of a real community in the San Joaquin Valley that's been doing some really important, exciting work. I became way more familiar with them when I was working at the California Public Utilities Commission, and I got to visit a few times and learned about the park. I don't know if he's going to cover the history of Allensworth in his presentation, but hopefully you're all familiar with it. As a visionary leader with over a decade of expertise in sales, operations, and management, complemented by a formal education in business administration and management, he has excelled in fostering organizational growth and social responsibility. As the CEO of Time Exchange Investments Corp., TXI Corp., he has championed the success of BIPOC, which is Black, Indigenous people of color, and women-owned businesses. His entrepreneurial journey, which includes founding and self-funding a successful retail brand, has significantly impacted his leadership in both private and capital ventures and corporate operations. In his capacity as co-associate executive director of the Allensworth Progressive Association, alongside Desiree Bagalayos, did I say that right? He carries forward the legacy of his family, especially his grandmother, Nettie Morrison, and his mother, Denise Kadara, both renowned leaders in Allensworth, and I would add they're just leaders across the region as well. I've known of them and met them many times. They're amazing women, as well as his father, Kaede. Their transformative work in the community focuses on climate adaptive initiatives such as regenerative agriculture, clean water technologies, the creation of a community resiliency center, and youth sports programs. These efforts are part of a broader vision to position Allensworth and the Tulare Lake Bed region as models for rural climate resilience and sustainability. He emphasizes collaboration, building relationships across the region, state, and nation with subject matter experts and those serving overlapping populations, knowing that true progress requires collective effort. Without further ado, Tekoa Kadara.
Good morning, everyone. Thank you for having me. My presentation today is on Allensworth, and I wanted to start with this image. This image reminds me, this image also was taken in, there we go, This image was taken in spring 2023, right after the floods. Okay, so this image reminds me of the resiliency of the land. It reminds me of the resiliency of Allensworth, the community, and it reminds me of the resiliency of Pa'ashi. If you look in the back corner, that is Pa'ashi, or what many people know as the Tulare Lake. Okay, so in 2023, a lot of, as many of you know, that lake came back. And this just reminds me of resiliency of this region. To give you a little history, because I know many people aren't familiar with Allensworth, to give you a little history on Allensworth. Allensworth was founded in 1908 by a runaway slave, retired chaplain, and lieutenant colonel in the U.S. Army. Like, that title and just how I said that sounds like a movie in itself, right? But also with Professor William Alexander Payne, they founded Allensworth in 1908 and formed the Allensworth Progressive Association, which is the governing body of Allensworth. But the town thrived. Allensworth was designed to be Tuskegee University of the West. Colonel Allensworth worked with Booker T. Washington at Tuskegee in Alabama, and that's what Allensworth was designed to be. So when Colonel Allensworth came west, he brought educators, he brought innovators, he brought business people, he brought woodworkers, steel workers, and they positioned themselves right along a railway, which was convenient for their commerce and, you know, all the different things that they were going to be doing in Allensworth. Allensworth thrived. Allensworth in the early 1900s was making probably about $4,000 or $5,000 a month, which is almost $1 million a month in today's time. So it was a thriving community back in that era. But the downfall came rather rapidly. In 1914, Colonel Allensworth who also had a home in Monrovia, was attending a water meeting because water was promised to Allensworth and it was not given. So Colonel Allensworth attends this water meeting. Upon leaving this water meeting, he's hit by a motorcycle and killed. So, which begins the decline of Allensworth. Shortly after that, that rail spur that I said was a big part of their economy was moved 3 miles just down the road to the neighboring white community. So Allensworth was effectively cut off from water, and then they were cut off from their commerce. So systematically taken down. By the 70s, Allensworth was pretty much a deserted town. Some people still went to the elementary school there. Some people still went to the church in the state park. But by the 70s, it was set to be demolished. By 76, a man named Ed Cornelius Pope came into Allensworth and said, we want to save this place. The colonel's home is still here. The first library in Tulare County is still here. And this is worth preserving. So he got with the NAACP, some other partners, and worked to preserve Allensworth, and is deemed a state historic park today. But this is where my family comes into the story. My grandmother moves into Allensworth in 1976 and saying she wants to be a part of history. And in that, she fought off 2 mega dairies. She fought off a sludge treatment facility. She fought off turkey farms. I wouldn't feel comfortable inviting any of you to Allensworth if we had any of those things inside or neighboring Allensworth, right? So she fought those things off. Shortly after that, my mother comes in, and she's the one that brought on the capacity for people like myself to be here speaking to you. You know, we were able to get some funding via the Legislative Black Caucus in 2022, and that gave us the ability to start working on saving our community, revitalizing our community. So just to catch you guys up to where we are now. So in Allensworth, we believe in, we prioritize our friends, partnerships, stewards, we prioritize bringing friends, partners, and stewards of being friends and partners and stewards to our ecosystems and neighbors. I'm sorry, I got a little tongue twisted there. But I believe in the 4 S's. And right now I know it only says 3. There's a spot we missed. But it's solidarity, sovereignty, and sustainability with stewardship attached. We believe if we make these priorities in our community, then we can change the historical ways that we've been taken advantage of in our community, and we can make our community healthy. We can fix our soil quality, our water quality, and our air quality. Some of the issues that we're working with in Allensworth, you know, and again, just speaking from the community's aspect, is we have lack of access to healthcare. So I'm hearing about asthma, and I'm thinking about all the kids that cough year round, right? We're thinking about valley fever, and my grandmother passed to valley fever. We had a resident 3 years ago, 26 years old, 3 kids that passed to valley fever, right? So we don't have access to healthcare in the community. Lack of clean water. We have a well that's 3 miles outside of our community. And that well it ranges between 7 and 15 parts per billion arsenic, with the state maximum being 10, right? So most of the time, we're not able to drink this water on any level. Directly beneath Allensworth is over 300 parts per billion arsenic. There's no way you can drink that water, right? So those are some of the things that we contend with. And we're in a food desert. So a bottle of water or anything like that is 20 miles away. Walmart is 20 miles away. Sprouts is even further than that. We want to bring awareness to our soil. You know, I love the picture that was just shown of the big dust cloud, because it's like the LeBron James when he claps. That's what it's like when it gets windy outside. Our kids can't go outside. I've spoken on water. Power insecurity. In Allensworth, the power goes off for a split second, or sometimes it goes off longer than that. But what is that doing for medical devices in our community, for people that need these devices to live? What is that doing for people that are already poor and have to go buy a new refrigerator, right? The air quality, we've talked about that. The aerosol sprays, the pesticides, all of these different things that our community has to contend with just because of the region. And then climate. For me, again, I see Paashi in the background. 2023 was probably one of the cooler summers that I remember in a really, really long time. I think I don't really feel like I need a scientist to tell me that when water is on the ground, our ecosystem and our environment is a lot cooler. Less than a year, that water was gone, and we had 40 days straight of over 100 degrees in Allensworth. So for us, it's just really, what are we doing? And what can we do to alleviate some of these problems? We ask ourselves these questions and we try to come up with some answers. So we have a holistic approach. We want to build Allensworth's community capacity to be able to protect ourselves. Because when those floods came, guess what? Nobody came to help us. We had to get out there and plug those levees ourselves, right? So we want to build the capacity to get out there and protect ourselves through regenerative agriculture, because we believe in stewardship. And there was a way that this land survived and thrived a long time before we got here. And in just a few years, a few hundred years, we've completely destroyed what Mother Nature was already doing. So we want to go back to practicing those ways and that kind of stewardship. And with that, you get water resiliency. Because we now realize that, well, I realize stewardship is giving back. I feel like farming is almost extraction. And I think we need to change our ideas about how we look at these things, because we're running out of resources. Agrivoltaics will help us with our power and our food security. If you're unfamiliar with agrivoltaics, it's the combination of using solar and growing food at the same time. And then landscape restoration, because I don't want to see an Amazon warehouse next to Allensworth. All this land's coming fallowed. I don't want to see this warehouse. I don't want to see this all solar. Like, let's bring back some fresh water. Let's create habitat for the blunt-nosed leopard lizard, the burrowing owl, all these endangered species in this region. It's not just about us, right? We plan on doing some of this. We have our farm enterprise projects. One of our farm enterprise projects starts with a rabbitry. We want to use rabbits as a protein source for their pelts and their manure. We want to use their manure and run that through a vermiculture system, which is worms. And we want to create our own organic fertilizer. We want to take our community waste and cardboard and things of that nature with the worms and make our own soil and remediate our own topsoil. So now we can have healthy food again. And I'm not relying on Walmart's organic. We have a farm explorer training program, or a farming explorer program, which is a 7-week program, which is designed for those that may have an interest in regenerative agriculture, those that may be willing to crack the shell on if they want to do it. We have a beginning farmer training program. That's a 7-month program. That's more in depth, that if you want to get into regenerative regenerative agriculture, if you want to own a business in regenerative agriculture, this is a program that, you know, you would consider. And then again, agrivoltaics. For us, it's just a great way for us to create an economic engine for ourselves, provide energy and food sovereignty for our community. Some other things that we're working on. This arsenic remediation project is an amazing project because I'm telling you that we have 300 parts per billion beneath us, and we have a well that's above the limit all the time. So Dr. Gatgill at UC Berkeley has created an arsenic remediation technology that pulls arsenic out of our water. That 300 parts per billion down below 3 parts per billion. So we're working on IP with UC Berkeley and Dr. Gatgill to bring in this arsenic remediation technology into a kiosk. So, you know, when you go to certain places and they have the water kiosks, so now our community will be able to put a quarter, maybe 2 quarters in this machine and have affordable water. That's huge for us. That's huge because you can't drink Allensworth water and, like I said, silver teeth, all the kids. Project-based learning is a summer program that we have that teaches our kids about multi-benefit land repurposing. It teaches our kids about agrivoltaics and things like this in the summer, and they take field trips and have hands-on workshops. One project that I'm super excited about too is the Allensworth based learning, Allen's athletics-based learning program. I'm the assistant coach of our cross-country team. 2 years in a row, we've gone to the national championships, and we've only been running for 2 years. Allensworth has 6 All-Americans in between the ages of 6 and 10 years old. So resiliency, right? Resiliency. I would say it's something in the water, but I don't want to say that. Okay, so land acquisition. All of these projects I'm talking about require land, right? And we're in a position of probably one of the largest land transfers probably since the gold rush or something like that in California because of all this land being fallowed and things getting ready to happen. So I just want to say, imagine if Allensworth was able to acquire some of this land. We can build out our farm enterprise projects and things I've just talked about, but we would also put this in some kind of land trust. So where the community owns it, the community benefits from it, and it's not governed by one particular person, it's community owned. And part of that vision, like I said, is this basin has maintained surface water for thousands of years. It's just in the past 200 that we realize that we can't keep water on the ground or under the ground, right? So let's maintain some surface water. Let's see if we can help with the climate, if Allensworth could have some surface water. And it's possible because the White River runs right into Allensworth, which is part of the reason that we had flooding in 2023. We've talked about ecosystem restoration, habitat rehabilitation, passive recreation, things for people to do. A lot of this land also has almonds and pistachios on it. So if something, you know, ends up for sale, maybe there's a way to regeneratively farm it and create an economic engine for Allensworth. So we're looking at all of these different options to help ourselves, help the land, which in turn helps the climate. Everything works together. And yeah. I know I'm probably running short on time, but this is our resiliency center. So we've talked about we're in a food desert and things of that nature. The resiliency center, this was designed by architect Art Dyson of Fresno, protege of Frank Lloyd Wright. And some of his final works before he retired, he designed this building for us. And we're in the getting ready to go into breaking ground actually really soon. But it has a medical center. It's got heating and cooling space. It's going to have a restaurant, a kitchen, a cottage store, postal services, offices for the Allensworth Progressive Association and our community services district, a computer lab for students when they get out of school. Let's see, the water kiosk and retail space for some of our entrepreneurial minded community members. This is the Allensworth Alliance, the Allensworth Progressive Association, the Allensworth Community Services District, the Allensworth Elementary School, Allensworth Community Development Corporation, and the Allensworth Community Action Committee. And we all work together to pull all these projects together. So working to create an ecosystem that will improve community health and generate community wealth while addressing climate change. And before I close, I just, I was speaking with Robert Jeff. I don't know if anybody knows him, but he's the vice chair of the Santa Rosa Rancheria Tachi Yoka tribe. And he let me know, TK, man, we all have ancestors that have died on this land. So we all have a right to this land. But having that right, we have to be responsible and steward the land. So I'm excited to say the plans that Allensworth has, I think are in alignment with that. I think the plans that Colonel Allensworth had are in alignment with that. I think the plans that my grandmother had are in alignment with that. So I just want to give an acknowledgement to the work, give acknowledgement to the ancestors, and give acknowledgement for you all for being here. Thank you.
Wow, that was awesome. Again, I learned a lot more about what you guys are doing. I think it's you guys have accomplished a lot since I last talked to you. I have a lot of questions, but I think I'm going to open it up to questions from the audience first, because I think there's probably a lot. And then if they don't have any, I have some. So is there a microphone that how does it, okay. Does anybody have any questions? I see, is Dr. Tellis here? Any questions from the audience? Yes. Or comments?
Sure. Dr. Sherriffs, thank you so much for joining us. We saw your data earlier. You talked about a lot of the factors. It was a very sobering presentation. Ag burning specifically, just banned this January. State Senator Dean Flores put forward that piece of legislation in 2003, and only now have we actually done something about it. And for context, I was in high school when that happened. I'm nearly 40 now. It seems as though some of these have become partisan issues, because if you read his editorials, there was a lot of pushback from industry. So some of these things that seem like they are easy decisions for us to make are taking 20 years to implement. Meanwhile, we are all suffering. Is that an accurate representation of what's going on?
Thank you for that question. You know, it took a long time. Clearly, it wasn't easy. Change is difficult. And a lot had to happen to go from that vision of an end to open burning to where we are this January. And I'm going to go back to collaboration. It took a lot of collaboration to make that work, to get everybody on board, for it not just to be a top-down kind of decision, but for people to embrace the challenge.
I have a question for him. You say to the here the school buses, the one incentive, they are exchanging it for the school bus. How about that one? I'm asking for the school. Are all the buses going to be changing it for electric?
Is this for Dr. Sherriffs as well? I know that the answer is not yes. they I think over time, she was asking about if all of the schools will be switching to electric school buses. So that has been a long-standing program.
Yeah, the electric school bus program, you know, it's an example of a program I think we can all get behind, because we're talking about one of the most vulnerable populations. And so it seems an obvious priority to change out those diesel buses, high-emitting buses, to low-emitting, and indeed to electric school buses. I know the Fowler School District has embraced this, and they have solar, they have charging. It's just magnificent to see that example and that, showing that it can be done. Buses are expensive. Sometimes the routes are challenging for the electric platforms. So there's a lot to make this work. But ultimately, I think we're going to see, absolutely, we're going to see electric school buses everywhere. But there's a lot of work still to be done to make that happen. There are also a lot of opportunities. There's a lot of grant funding out there for schools. So I'd encourage anybody who's interested in pursuing that. Yeah, contact the Air District. That's a great place to push that.
Yes. Yeah, I think eventually yes is the answer, but maybe not like today or in the next near term.
This question is for Dr. Solis. You had shown that slide that showed that a lot of the health issues for valley fever on the west side. It's interesting because I lived on the west side and I live on the east side. There's a lot more wind out there, a lot more dust. And now there's a lot of repurposing for solar panels. And so then that land doesn't have a crop on it. Are you interjecting at all on any of the kind of land use purposes and talking to folks who are doing that there may be some better ways to do the land repurposing because of this issue with valley fever?
That's a great question. And in my specific role, I haven't done that. But I can look back and talk with our department to see if there's any organizations that are involved in that. But I can't specifically speak on that because I don't have experience or have had those discussions. But not sure if anyone on the panel has had that. But yeah.
I actually, because this is kind of the first time other than when I first met you last week, I'm really thinking about valley fever. But I know that the measures that the Air District requires for dust mitigation actually seem to me like they have much more importance now than previously, even just for PM 2.5. So that's when, construction is already happening. As far as like land use planning at the county level, I have never heard of a consideration of valley fever about what kind of projects, but I could have missed that. And maybe it's something that we need to bring up at the Fresno County supervisors meetings. I also had a question about valley fever while we're waiting. I don't know if you mentioned it, but I always understood that people who did not live in the valley were more susceptible to it. Is that a misconception or a myth? I thought that if you grew up or were born here, that you had maybe less of a chance of getting it.
Haven't seen that
No?
research. So yeah, anyone who lives here, travels through the valley, can get it. And you're more likely if you do have, like if you're at the high risk groups that we discussed. But yeah, just growing up here doesn't make you more immune.
Okay, it's a misconception. Thank you. Mythbusters. Thank you.
Yeah, so my name is Patricia Flores. My question's for Tekoa Kaidara. Most of my work has been in environmental justice. Now I'm working with American Rivers, doing floodplain, multi-benefit floodplain restoration in the Central Valley. A lot of my work has been bridging Indigenous communities with Black communities and communities of color. I'm kind of curious, Santa Rosa is really close to my heart. What kind of work are you all exploring with Indigenous communities in the Valley, and what benefits do you see for that?
Great question. We are working with the Santa Rosa Riatachi Yokuts on a trail that will go from Atwell Island to our state park to the cemetery. The state park now, we are in ownership of the State Historic Cemetery. So if you've been to Allensworth and seen some of those buildings, the people that own those buildings are still in our cemetery, and we just now got possession of that. So the walking trail would go from Atwell Island and around Allensworth. We're also working with BLM, the Yokuts, Audubon Society, and a number of other partners to talk about management of Atwell Island back to the Yokuts. So it's a project that we've been working on in the shadows. So yeah, we're doing some good work.
Thank you. And I don't know if you made a plug, but there is a big Juneteenth celebration in Allensworth. No?
Yes.
Yes.
Every year we have 4 major events. The Black History event just ended. We have Juneteenth that will be coming up. I don't know the exact date that we're going to be hosting it this year. It may be the 10th, but it's the second Saturday. We have a May festival, and then we have the rededication in October. So all you are invited. All of you are invited. I would love to see you in Allensworth.
Yes, I really encourage you to go visit that state park if you haven't already and take your kids. It's really interesting. More questions? Yes, up in the front. Or over there first, I guess. We'll come up to you next.
Well, I had a couple of short questions. One is for Dr. Solis. If you could comment a little bit on, well, and also about vaccine for valley fever. And then for TK, I wanted to thank you for your presentation. It's marvelous. I'm from Merced County, and there's South Dos Palos, for example, had a similar situation with slave people, well, former slaves founding the area. But I wanted to ask about the arsenic in the water. Is that related to water being pumped in for irrigation? I know on the west side, there's been a lot of that.
So I can go first. And so the question about, is there a vaccine right now for valley fever? So currently there is no vaccine that's available for valley fever, but that is something that scientists have been looking at and researching. So hopefully in the near future, there will be one that's available, but at this time there's not.
And to the arsenic question, we're finding that the arsenic is naturally occurring, being that, you know, it came down from the streams into the river, that it naturally settled in the aquifers. And just over time, as we continue to pump it, that concentration just gets heavier and heavier. So that's really what's happening. It's naturally occurring, and it just came down with the rivers way back when those rivers flowed.
I think we had one up here, and that might be the last one, I think, or we have two, maybe two. Well, I'll take two, and then I think we need to wrap. Is that right? Yeah.
This is for Tekoa. You talk about land being fallowed and being available, and most of your projects require land. Is there, how do you find out what land is available when somebody is ready to sell it? Is there anywhere in the Central Valley a sort of central listing agency, a real estate agency saying this farmer's giving up and his land's for sale? And where would you get the funds to buy the land?
Great question. Let's see. I know Shul Real Estate is huge in this area, and that's who has been helping us get a lot of information on the properties in the area. Just to give you some perspective, if you're familiar with Allensworth, the property just south of Allensworth, a Manu Life or John Hancock farm, is 5,000 acres, was going to be fallowed, but we just found out that they're moving, they're leaving. So 5,000 acres are about to be available. So I'm not saying Allensworth is going to try to acquire 5,000 acres, but to get a chunk of that would be something. And, you know, us talking to groups like this and people wanting to support, that's one way we find funding. We are working with a number of philanthropic organizations and foundations. We have some funding through the APA ourselves. So there's ways to make it happen. There's ways to make it happen. And I'm optimistic about the opportunity to, again, this is the biggest land transition. This is the potential to be the biggest land transition in a very, very long time. So I'm glad Allensworth has an opportunity to participate.
Yes, for Dr. Solis, I also had valley fever at one point in time in the past, I don't know, 4 years, something like that. Are there processes? I know there's processes to test soil, but as far as like, you know, turning soil over that has been, you know, known to cause cases of valley fever, is there processes that people can go through for that?
Can you clarify, like, is there research going on to check, like, if you overturn the soil, is there?
Yeah,
Like,
yes,
I think he's asking if there's a, like, even a
Not just the process, but
consumer
research.
way or, you know, way for people to test the soil to know if it's going to be causing valley fever. Is that?
So that's a
Yes.
good question. I think I'll have to get back to you on that one because I'm more familiar with the medical aspects and, but I know there is a lot of research out there that is looking at the cycles of the rain and the drought and testing the soil. But at this time, I'll have to get back to you on that. Great question though. Thanks.
I think we're going to wrap it up, but I want to again give a round of applause to all of the speakers. Thank you very much. We learned a lot, and hopefully we can all take away some ideas of how to support and make progress in this area. Thank you.